Good morning. This is Ron Oldham, working with the Foundation for Healthy Generations. Welcome to today's webinar on e-cigarettes and vaping. The Foundation for Healthy Generations, formerly known as CHEF, or Comprehensive Health Education Foundation, has worked for a number of years now with the Washington State Department of Health to present information about no smoking policies to housing authorities throughout the state. And one of the issues that has come up recently is what to do about e-cigarettes and vaping in residential rental properties. So that's what our topic is about this morning. We hope to provide you with a lot of information from our panelists about about e-cigarettes and vaping. There may be some others besides housing authorities on this call, so we welcome you as well. Anyway, we hope that the housing authorities and providers of affordable housing will be able to use this information in the operation of their rental housing, keeping in mind that the fundamental obligation a landlord has is to provide a safe living environment. Today's technology changes so quickly that it is difficult to keep up with, especially when that change may pose questions about the environment and how it affects people's health or public health in general. The changes are rapid, but the answers and potential responses tend to take longer. This is the case with e-cigarettes and vaping. Are they harmful or just a safer alternative to smoking tobacco? Our panelists will talk about whether or not they are a potential aid to help people who are addicted to tobacco, smoking, and nicotine quit or not, and also what some of the other issues are. The pronouncements about tobacco, of course, were decades in coming, and for a long time people really knew that there was a problem with tobacco, but there was a debate about it for many, many years. And the same thing is happening right now with e-cigarettes and vaping. There's not any really conclusive answers as there are with the issue about tobacco, secondhand smoke, and smoking. But there are things that are starting to come out, and we hope that it will not take as long as it did for tobacco to get a good handle on e-cigarettes. At least one housing authority in the Northwest, Kennewick, has come out with a firm position on e-cigarettes. That housing authority has recently banned their use in their rental properties based upon information that they have collected from a variety of sources. Even more recently, in the last month or so, the American Society of Heating, Refrigerating, and Air Conditioning Engineers, also known as ASHRAE, A-S-H-R-A-E, added emissions from electronic smoking devices as a substance that contributes to the creation of an unacceptable indoor air quality along with cigarette and marijuana smoke. Our presenters today will offer some detailed information from their perspectives and backgrounds about e-cigarettes and vaping, and hopefully bring you up to date on what is currently known about their use. It's our hope that you'll use this information to make sound decisions about what you want to allow in your rental properties. Our first presenter today is Dr. Jessica Pepper from the University of North Carolina. She will be followed by Deb Drandoff, who works with education in the state of Washington, and then Paul Davis from the Washington State Department of Health Tobacco Division. With that, I will hand this over to Dr. Pepper. Thank you.
Hi, this is Jessica Pepper. I'm a postdoctoral fellow at UNC, and I'm very pleased to be here to join you for this webinar to tell you a little bit about the basics of electronic cigarettes. So just to put this in a little bit of context, tobacco is the leading cause of preventable death in the US and worldwide. It's responsible for 1 in 5 deaths, and almost half of smokers will die prematurely from smoking. Currently, about 18% of US adults smoke, which is over 40 million adults. Smokers really want to quit. They tell us that very consistently, but it's very difficult to quit. We have nicotine replacement therapies like the patch or gum, and these do really help smokers quit successfully, but they tend not to use them. So only among those smokers who have made a quit attempt in the past year, only about 30% have used a cessation medication. So that's kind of the landscape of the public health problem of tobacco and nicotine, into which we're now bringing a new product, which is the electronic cigarette or e-cigarette. The first thing I want to emphasize here is that this is a product that goes by a lot of different names. So you may have heard names like vape pens or vapes, e-hookah, mods, personal vaporizers. But these are all just different names for a family of products that have the same basic functionality. So I'm going to use the term e-cigarettes, but I'm really referring to anything in this category. So these really all kind of work the same way. They have three basic components. There's a power source, which is usually a battery. There's e-liquid, which typically has nicotine. And there's an atomizer, which is a heating element that heats up that e-liquid until it becomes a vapor that the user inhales. The e-liquid has kind of three major components to it. The first is a humectant, which is basically a chemical like propylene glycol or vegetable glycerin that keeps the e-liquid moist. The second component is flavoring, and the third component is usually nicotine, although there are non-nicotine versions available. So the concentration of nicotine typically varies from about 0 milligrams per milliliter up to about 36 milligrams per milliliter. First generation e-cigarettes are often referred to as cig-likes. You can kind of see why here. They are approximately the same size and shape as a cigarette. These can either be for one-time use, that can be disposable, or you might be able to change out their cartridges and recharge them and use them over and over again. These are very accessible. Around here you can pick one up in your local gas station for somewhere between $5 and $10. Second generation model e-cigarettes are often called pen-style or tank-style e-cigarettes. You'll often hear these referred to as vapes or vape pens. These have a larger tank that holds a few milliliters of e-liquid. And they also have larger batteries, which heats the e-liquid to a higher temperature, and users say that produces a more satisfying vapor. And you can refill these. You refill the tank with a few more milliliters of that e-liquid, which is available in many different varieties of nicotine strengths and flavors. The newest models of e-cigarettes, or these third generation e-cigarettes, are really sort of a class of personal vaporizers that can look a whole bunch of different ways. This is just one example. And these are entirely personalized and customized. They're often called mods. And so the user chooses all of the components, the battery voltage, the atomizer type, the mouthpiece. And with these, you can either refill them with e-liquid, or you can actually drip e-liquid directly onto the heating element. And again, these can look all kinds of different ways. Other products in this category, e-hookah or hookah pens, e-pipes, there are a whole bunch of others, as I said, different names for the same category of product that all kind of function the same way of heating an e-liquid into a vapor. So I'm going to talk about a little bit who uses e-cigarettes and why. From large population-based surveys of U.S. adults, we tend to see that e-cigarette users are almost exclusively current and former smokers. They tend to be younger adults, non-Hispanic whites, and often have higher education and income. In terms of reasons for use, the most commonly reported ones are that they're perceived as less dangerous than cigarettes, they can help to quit or cut back on smoking, that they can cost less than cigarettes, they can be used in smoke-free areas, and that people are frankly pretty curious about a novel product. A lot of people also enjoy the vaping culture, particularly around mods and personal vaporizers. And finally, they might be attracted to the advertising messages, and there is a lot of e-cigarette advertising. In terms of what the trends look like here in the U.S., we've had a very rapid rise in use of e-cigarettes. So this data is from a large U.S. survey. Back in 2010, only 2% of U.S. adults reported ever trying an e-cigarette, but as of 2013, 13% said that they had ever tried one. In terms of current use, that's adults who say they use e-cigarettes either every day or some days. About 7% of U.S. adults in that same survey said that they used e-cigarettes some days or every day. Among youth, trends have looked pretty similar, just this very dramatic increase. And what's very concerning is that in a recent large survey of U.S. middle and high school students, more students said that they had used an e-cigarette in the past 30 days than that they had smoked cigarettes. So that's a trend that we really want to keep an eye on. This is national data that I've been showing you, but Paul Davis will show you some data specifically from Washington State. So here's the question I'm usually asked, are e-cigarettes good or bad? And of course, there's potential for both. So let's start with the bad. Unfortunately, there are some issues of safety and health for users, but the data on this are very, very inconsistent. So some studies show no detectable levels of toxicants in the vapor that comes out of e-cigarettes and in their e-liquids, but others do show some testable and concerning levels of toxicants. This varies a lot by the type of model of e-cigarette that was tested. how it was tested, and the type of e-liquid that was tested. I would say the one thing that we see pretty consistently across studies, regardless of exact amounts, is that e-cigarettes tend to have fewer chemicals and in smaller amounts compared to tobacco cigarettes. There are some pretty clear and consistently reported short-term minor health effects, so things like headache, nausea, coughing that you see in many, many studies. There have also been some case reports of more serious illnesses like pneumonia, but these reports are uncommon and hard to confirm. We really don't know yet about long-term health effects, but I would say sort of as a take-home in terms of safety and health for users, we're talking about a product that is less harmful than traditional cigarettes, but certainly not harm-free. In terms of secondhand vapor, we do know that there is nicotine in the air that non-users would be exposed to if someone around them is using an e-cigarette with nicotine. The actual quantity of nicotine in the air could be anywhere from about 1/6 to 1/10 the amount that you would see from traditional cigarette smoke. Now, if you're looking at what's actually absorbed by people living in the home, for example, looking at the amount of nicotine in their saliva, it looks like they're absorbing somewhere around half the amount of nicotine as people who live as smokers. But you have to keep in mind that these are from very small, very preliminary studies. There's also 1 or 2 studies showing exposure to other harmful toxicants through secondhand vapor, but this is not consistent. We do know that there's a lot less support for banning vaping indoors than there is for banning smoking. So for example, in one study, 63% of U.S. adults supported banning cigarette smoking in the home, compared to only 22% for banning e-cigarette use in the home. Most e-cigarettes contain nicotine, which is a toxin. In small doses, you can get minor nicotine poisoning, which often has effects like headache or nausea. But in large doses, it can be fatal, particularly for kids. Here's some data showing calls to national poison control centers, and you can see this huge increase between 2012 and 2014. Later on, Paul Davis will show you some data about poison control centers in Washington State. Another potential bad when it comes to e-cigarettes is their use by youth, which has increased dramatically. They might be attractive to kids because of their flavors, things like blue raspberry or bubble gum. In a recent online survey, there were almost 8,000 unique flavors of e-cigarettes being sold in the United States, and a lot of these are very sort of kid-appealing kinds of flavors. They're also potentially perceived as sort of high-tech and cool. They have very slick advertising in a lot of cases. We're worried that if kids see people using e-cigarettes, it could remove some of the existing stigma around smoking cigarettes, and that stigma has actually been a relatively effective deterrent at keeping kids from smoking, so we don't want to re-normalize what it looks like to smoke. Another concern is that kids might like the nicotine buzz or like the experience and sort of graduate to start smoking cigarettes, which we refer to as a gateway effect. We do know that kids who use e-cigarettes are twice as likely to say that they plan to start smoking cigarettes in the next year as kids who don't use e-cigarettes, but we don't have good data yet about whether they actually go on to do so. So the gateway issue is something that we're concerned about, but we don't really have good data about whether it's occurring. The last sort of potential bad that we're worried about is the effect of cigarette use on, the effect of e-cigarette use on regular cigarette smoking. So many users of the product are what we call dual users. They both use e-cigarettes and smoke traditional cigarettes. That's problematic because it maintains their addiction to nicotine, and it might also prevent them or delay them from making quit attempts. So for example, they might be someone who they can't smoke at work, and that might make them want to try quitting smoking, but if they can now use an e-cigarette at work, perhaps that takes away the motivation to try to quit. So it's not all bad. There are some potential goods for e-cigarettes that we want to talk about and acknowledge. The first is that we do know that they are safer than traditional tobacco cigarettes. The most dangerous cancer-causing chemicals in cigarettes are produced by combustion, from lighting tobacco on fire. And you're not actually lighting anything on fire with an e-cigarette. So from a harm reduction perspective, for an individual smoker, if that smoker can't quit, it's better for them to switch to an e-cigarette for their personal health. The real crux of the debate here is whether or not e-cigarettes can help some smokers quit. And Drandoff is going to talk about this in quite a bit more detail. We do have some evidence showing that it helps smokers quit and some that it doesn't. Our sort of gold standard evidence would be randomized controlled trials. And we've got one very good trial so far, and that one showed an equal rate of quitting for people that used an e-cigarette with nicotine and people who used the nicotine patch. That's very promising, but it's also you have to take that into consideration that there's also a lot of survey studies and other studies showing mixed results. So in some cases, you'll see survey studies that show no association between using e-cigarettes and successful quitting. I want to definitely emphasize the importance of taking a population-wide perspective here. If e-cigarettes helped smokers quit, that really helps to address one of the most important and deadly public health problems in the U.S. But to be beneficial at the population level, the number of people who quit has to sort of balance out all of the other potential problems that I was talking about earlier, things like nicotine poisoning or use by kids. And we just don't know where that balance lies right now. In terms of regulation, this is currently only regulated at the state and local levels, and you'll hear more about what's happening in Washington State specifically a little later on. At the federal level, the FDA has proposed some national regulations, which include provisions like not selling to minors, not giving free samples, having to disclose ingredients, and providing warning labels about the potential harmful effects of nicotine. These are currently, have not yet been enacted and would take quite some time to be enacted. So to conclude, I want to remind folks that I use the term e-cigarettes throughout this talk, but this is really one name for a product that goes by a lot of different names, and to keep in mind that this is all really a family of similar products. These are dramatically increasing in popularity, and I think we're going to continue that trend. We do believe that they are less dangerous than traditional tobacco cigarettes, but we're not really sure exactly how much, and the degree to which they are safer might also be changing as the product itself evolves. We have some evidence showing that newer models of e-cigarettes might produce more harmful chemicals than older models. It is a possible but very much unproven tool for smoking cessation. We're very concerned about use among youth, and there's really a need for strong regulation in this area. So those are the major things that I would like you to take away in terms of the basics of e-cigarettes, and I can now turn it over to the next presenter. Thank you.
Hi, my name is Deb Drandoff, and I'll be doing the next segment of this webinar. So my background is I've been working for about 10 years assisting addictions and mental health treatment agencies in implementing addressing tobacco in their work. And the e-cigarette issue has come up quite a bit lately, and I get a lot of questions about what's the role that electronic cigarettes play in helping people quit smoking. And so for the brief segment I'm doing on this webinar, that's what I'm going to be focusing on. So one of the first things we look at is what's the research? What do we know about how e-cigarettes help with the quit process or not? So we had a couple of research studies, and we take a look at that, and the research is actually quite mixed. We have some of the research has shown that it absolutely does nothing to help with the quit attempts, and then some of the research studies show that actually electronic cigarettes have about the same success rate in helping people quit as the FDA-approved nicotine cessation. So mixed results, some have found it helpful and some haven't, but none of the studies have any more effective than our traditional nicotine replacement products. So some of the concerns that I have on this slide have already been discussed in our previous slides, but what I want to focus on is the first two bullets in this slide. One is the fact that there's so many different brands and varieties of this product that we just have no standardization and quality control. So depending on what device people purchase, the quality of the dosage and the accuracy of the dosage can vary widely. We've tested some of the products and found that several of them that say they have nicotine have very little nicotine in them. We have other devices that actually, when tested, show that they contain much more nicotine than what's been advertised. So if somebody is using an electronic cigarette to quit smoking, and we're really needing to actually use this as a nicotine replacement device to match the amount of nicotine they've been getting from their cigarettes now with the electronic cigarette device, we're not sure what we're going to be getting. So somebody who's quitting smoking can move to this device and all of a sudden get much less nicotine than what they were getting, which could put them into immediate nicotine withdrawal symptoms, which puts them at a real high risk of relapse to smoking. The reverse could happen in that they could be getting much more nicotine than what they were getting out of their cigarettes. So we're not helping with that addiction, we're actually increasing the nicotine addiction problems. So no standards, no control. It's very difficult to know what you're getting, especially in the cheaper models. And as has been mentioned, we're continuing to learn about some of the new dangers as far as the types of carcinogens and just the general safety of that device. So there's three, what I looked on actually sitting down and helping somebody to develop a quit plan and actually quit smoking. There's three factors we sit down and work on when developing that quit plan. I call it the three-legged stool. There's three areas we have to address that equally impact a person's ability to quit smoking. So the first one that we look at is the actual physical addiction to nicotine, the physiological, biological factor. As we know, nicotine is one of the most addictive substances that there is. So the first thing that we address in the quit plan is how are we going to address the nicotine addiction? And depending on how much somebody smokes, that's where we start looking at a nicotine replacement product to be able to get them their nicotine so that they don't go into immediate withdrawals and then can slowly start weaning off of the nicotine. So when we use electronic cigarettes to assist with this, there are several issues that come up. And one of those I mentioned before is we don't know exactly how much nicotine someone's getting out of that device. So using that device in that quit attempt, they're either going to get maybe much less nicotine than what they need or much more nicotine than what they need. So that's the first concern. The second concern, what I see, is that with current smoking, many people have really been able to cut down how many cigarettes they actually smoke every day. We have so many restrictions on not being able to smoke indoors. So many people are not smoking in their cars, not smoking in their homes, that these changes have really kind of reduced those times when somebody can smoke. And so that's naturally helped to help people cut down on actually how many cigarettes a day they consume. So the problem when they switch to the electronic cigarette is now all of a sudden the ability to use that device is much greater than smoking. They may be able to smoke at their workplace. They may start smoking in the car. They may smoke in the home. So the amount of hours in the day when they actually are able to use that device is going to be much higher than smoking. So what we've seen is actually when people make that shift from smoking to the electronic cigarette is they're actually very much increasing their nicotine intake and how much they use the device. Just because of the difference in it, we're seeing much higher use of nicotine when they switch to that device than versus cigarettes. So that's my first concern, is we may see that shift where they're actually intaking more and increasing their physical addiction. The second factor that we always look at is the actual psychological, the habit of smoking. And you know, this is just as strong of an issue and it's just as challenging to overcome as the physical addiction. The daily habit, from morning until night, the having a cigarette with a coffee, on the phone, while driving, It's tied to different activities, and that habit of the hand to mouth up to 200 times a day. A 1-pack-a-day smoker on average will do the hand to mouth routine 200 times a day. This physical habit of smoking and tying it to different activities is a very strong dependency that needs to be addressed. So when I'm helping somebody quit smoking, we dig into that and find replacements that they can do to address that. If we move to electronic cigarette, then we're just substituting. They're continuing to do the hand-to-mouth with the electronic cigarette. They're continuing to use that device with the different activities that they're engaged in. So we're just substituting the electronic cigarette for the regular cigarette, and we're not addressing that actual physical habit in any way. We're just continuing that process. The last factor that we address is the social rewards. And we see this especially with folks with mental health challenges that may have actual social awkwardness or barriers. Often that smoking really helps them deal with social situations. It's having something in front of them in their hand that they can use. So again, the third thing that we work on in the quit plan is what are they going to do different? What are they going to do about the social situations? If they have a group that they like to go smoke with, what are they going to do? And so again, we have the same issue with moving to electronic cigarette. Often we have people still joining that smoke group, but with the electronic cigarette. We also see the electronic cigarette industry actively promoting a new social culture, and that's the vaping culture. And especially with young people, it's now become very fashionable and hip to be part of a vaping group. So what we're seeing now is, again, that social reward shifting into the use of the electronic cigarette socially. And so once again, these issues are not being addressed. So I have real concerns when someone makes a shift to electronic cigarette that we're really not going to be addressing any of the components that that person needs to address to have a successful quit attempt. And they're just going to be shifting into a replacement system of the electronic cigarette, and they're just going to shift that addiction and possibly actually increase their nicotine addiction. So when we work with people to quit, it's just not something that we recommend.
Hi folks, this is Paul Davis from the Washington State Department of Health, and I wanted to be able to share some state perspective on e-cigarettes and vapor devices. This has been an emerging issue that's moving very quickly, and so by the time you hear this, it may be different even than what it was yesterday. But let me tell you what it is as of the spring or early spring or late winter of 2015. If I can get the slides to advance. One of the major concerns that we have in our state and in the rest of the nation is that e-cigarettes have, many of their products have been bought by big tobacco. And so you see here in this slide that Views, which you'll see sold at 7-Eleven, has been bought by R.J. Reynolds, and they're the makers of Camel. And Mark 10 has been bought by Altria or Philip Morris, and they make Marlboro and things like that. And then Blue e-cigarette has been bought by Lorillard, and they're the makers of Newport. And you can see down here that there are a number of these companies that have actually been bought by tobacco companies. And that's very important because tobacco companies have a very, at best, checkered history in terms of giving information about the potential harm of their products. And in fact, even recently, just a few years ago, they were convicted under racketeering charges as continuing to be deceptive in their practices and not telling the public all of the things that were potentially problematic with their products. And if we go back many years ago, they started to market light cigarettes, making people think that those were less dangerous than regular cigarettes. But as it turned out, they were not, and the cigarette companies knew that they were not, and yet they continued to market them as though they were less dangerous than regular cigarettes. And we see similar claims coming from these companies now saying that e-cigarettes are a less dangerous product than cigarettes. And so when we hear that kind of marketing, it makes us nervous because we've heard those claims before and they turned out to not be true. Now, it may very well be true that they are less dangerous because it's hard to make something as dangerous as a cigarette, but it's entirely possible that there are health risks that are not being told to us that they may even know about now, and it's even more likely that there are health risks that we just don't know about because these products are so new. So this is one of the things that we have concerns about. These products are forbidden from being able to market themselves as cessation products. Under the agreement with the FDA, FDA would not regulate them as drug delivery devices, but they would not be able to call themselves cessation products. Otherwise, they would have to be in the same category as like the FDA-approved nicotine inhaler that's available with a prescription. But there are a number of people that probably do try and use these to replace their habit or addiction to cigarettes. And you see that this is the kind of marketing that the cigarette companies put out. We see this on TV, which you can't see for cigarettes, and you see it in social media, you see it in print, you see it in billboards. And so they may not, at the company level, say that they are cessation products, but they are oftentimes encouraging you to switch from e-cigarettes or from cigarettes to e-cigarettes. And one of the concerns is, what if people don't really quit, but they use these e-cigarette or vapor products during the day when they can't smoke, but they still smoke at night and in the morning when they're at home and are able to smoke. And unfortunately, just cutting down on the number of cigarettes that you smoke per day doesn't end up helping you that much, because just having that cigarette at night or in the morning still has a huge potential impact to your health. So the potential to bridge that addiction rather than quitting is one of our main concerns. And at the local level, regardless of what FDA says, these things are often marketed as cessation devices. This one was actually from Ephrata in the center of the state, so it's not limited just to urban places on the I-5 corridor. These shops are all around and oftentimes are pretty expressly saying that they are using the opportunity to make a cessation claim when they're really not supposed to make that cessation claim because they haven't been proven to be effective or safe as cessation products. And we know from our own data of people calling the quit line, we encourage people to call the quit line and 1-800-QUIT-NOW, and that's a way to get help quitting. And we ask them when they call, are you using an e-cigarette? And between July of 2014 and January of 2015, you can see that we had about 175 of the about 2,000 people called that said that they were using e-cigarettes as a way to try and quit smoking. So many people are intending to quit and using these products as a way that they think might be helpful to them. And another concern is that youth are, has been talked about previously, a number of youth are using these products, and they're not using them to quit. The CDC released some information nationally that you got 250,000 students in high school that had never smoked a cigarette but had used e-cigarettes, and that was up by 3 times as many as it was in 2011. And so we know that it's not an effective tool for kids to be using to quit, and in many cases it's more likely that they are using these as a product to become addicted to nicotine, or other products too that they don't just have nicotine in them, they could have THC or other chemicals that could be potentially damaging or addictive. And so that's a great concern to us. And what does it look like in our state? Well, the landscape changes so much that we couldn't even ask the same question in 2014 that we asked in 2012. In 2012, we asked, did you use an e-cigarette in the last 30 days? And you'll see that 7% of 12th graders said that they used that kind of product in 2012. That went up to 23% in 2014. It's a huge increase. And in 2014, because the product had changed, we had to change the question. So we asked, did you use an e-cigarette or vapor pen? Because many kids don't call them an e-cigarette, they call them a vapor pen or a vapor product. And so it's a little bit difficult to make that comparison to 2012 to 2014 because we had to change the way we asked the question. But you can still see that regardless, there's an awful lot of kids that are using these products. When you see almost 1 in 5 10th graders and almost 1 in 4 12th graders that said that they had used an e-cigarette or vapor pen in the last 30 days. And that's very concerning to us. Another concern in our state is how many people are calling the Poison Center saying that their kids have been exposed to it. Most of those kids are 1 to 3 years old. You think about a little toddler. They're curious. They're down on the floor. They're all over the place, and they can find things and get into them. And you've seen that in many cases they are not in kind of packaging that would keep a 2 or 3 year old from opening it up and being exposed. And they don't have to drink the stuff to be exposed to it. Just getting it on your skin can cause a reaction to be concerning. That's why you can have a nicotine patch, because it comes through your skin. And so if a kid swallows it, that's a very serious concern, because there could be enough nicotine in it to be very toxic or even fatal. And though we haven't had any fatalities in our state, there was a fatality in a different state, and we don't want to have any fatalities in our state. So what's the current law in Washington State? Right now, it's illegal to smoke in any public place or places of employment, but that law does not extend to the use of vapor products. E-cigarettes and vaping are not covered by the smoking in public places law because it's not smoking. Now, there are some counties that have said, well, we want to make sure that that is covered, and so they've put local ordinances in place that say that you can't vape or use an e-cigarette in any place that you can't smoke. And those places are King, Pierce, and Grant counties, as well as Pasco City. Another law that's on the books that says that it's illegal to sell or give a tobacco product to a minor. And a couple of years ago, that law was changed so that you couldn't sell or give a vapor product to a minor either. But there is no current law that makes it illegal to possess that vapor product or use that vapor product if you're under 18. So there's not a way for them to legally buy it, but it's not illegal for them to possess it. Also, there's a state law that says that you can't use tobacco products on school property, and that has not been extended to vapor products, although our recent assessment of school districts in the state, almost all of them have a policy that say that you can't use an e-cigarette on their property, but that's not in state law yet. There are some bills that would regulate these products further. There are a couple of them that are interesting and have had some recent activity. One of them would regulate e-cigarettes, including taxing them. They can, the retailers have licenses and be subject to fines if they sell to kids or illegally market them, make them have child-proof containers, and ban flavors and internet sales. A pretty comprehensive bill, and that received a hearing, but it's not clear what that kind of law is going to look like in the future, because it's not clear that that it's going to have the political will to get through. There was a lot of vapor enthusiasts that were really opposed to many of those components. Another bill would raise the age to purchasing tobacco and e-cigarettes to 21, and that had a hearing, and it's got another hearing scheduled. And then there are some additional ones. Senate Bill 5477 would actually just require a certain kind of child-proof packaging and labeling and advertising, making sure that all the products have a child-proof container, and there would be a sign saying that nicotine is potentially dangerous and that you can't buy these things if you're a minor. So those are potential bills, and we'll see how they fare in the legislative session. So that's something to keep your eye on as well. So that's all the slides that I have, and my contact information is right there, and you're welcome to contact me by phone or by email if you've got questions, and I'd be glad to answer those as best as I could. Thanks a lot.